Hi there. In this video, we're going to look at how you would use our recall overview template for recording when blood samples are taken. Now, for this demo, I've added on some one-off requests. And here you can see the comment I've added in, as well as other reasons for adding the bloods. That's to just manually type into ICE or WebV. Sadly, it's not possible at the moment to make ICE or WebV auto-populate with this list. What we'd recommend doing is having two screens, and on one screen you have the recall overview, and on the other screen you have ICE or WebV. Failing that, you can split the screen in two. You can see as well here who the blood should go back to, so the person who requested it, in this instance, me. Over on the right-hand side, we've got a few useful buttons. First off, to launch ICE or WebV, it will work out which is needed for your practice. And then to record the blood sample taken, you've got two options. You can just tick blood sample taken, and then when you OK the template, it will give you a few more options. Or you can kind of get to that bit more quickly and pick here, and it gives you these options about blood taken left arm or right arm, or you might want to use a template to put more information in. You can also record home phlebotomy or bloods for secondary care, declined, failed, and so on. Just one other thing to show you. I'm going to pause the video and show you a slightly different way that the system can work for some practices that you may find useful. So what I've just changed is how the system is going to work now and demonstrate something. And we've developed over the years a way of recording all the bloods that have been taken. So if I tick this blood's taken and click OK, it's now asking me which bloods I've taken. And the reason for this is twofold, really. One is to check that all the samples are back. In theory, that's something practice should be doing, but it's very labor intensive normally. With this approach, we can code them, check they're back, and see if anything's been missed. And then the other is that it can enable us to communicate with patients in bulk. So, for example, we can work out all your blood tests are back, and they're all back and they're all fine. And so we can send that kind of message to the patient. Now, in this instance, most of the time, hopefully, you'll just be picking display bloods only, i.e. what's in the recall overview. There are some other options that you can try, but most of the time, that's be what you pick. In the background then, if I can show you this, it's a bit clunky and it's not the tidiest. Unfortunately, that can't really be helped. But we can see that the protocol has recorded both in free text all the bloods that we've taken that were displayed on the recall overview, and also it's added various codes for them. And that's what the system can use to reconcile the bloods. If you've not got that enabled for your practice at the moment and you'd like to, do let us know. But yeah, we'd recommend triggering it like that, where you tick the box and then OK the template. You can do it using the blood sample taken button, but it's a bit slower because we found that protocols run more slowly when you've got a template up. Overall, though, the idea is to make recording of bloods taken nice and quick and easy, and make it really clear exactly what bloods it is you need to take and why.